Hi, it's Dr. Williams with Peacock Pediatrics. I wanted to talk today about autism. Autism is a developmental disorder that affects communication skills as well as behavior patterns, often presenting in toddlers. It's a wide range. We call it a spectrum because it's a wide range of symptoms and concerns that these children might have, and it affects everyone differently. So it may affect as many as 1 in 54 children, according to the CDC. It typically becomes apparent after the first birthday, but in children who are more mildly affected, it may not be diagnosed until much later. Early intervention is key, which is why we really want parents to be aware of autism and what autism looks like in toddlers, or what it might be presenting like in your toddler, because the earlier we can intervene and provide therapy to your child and your family, the greater we can help your child to succeed and to reach their maximum potential. There are a couple of key symptoms in autism that you should be aware of. So the first is deficits in social emotional reciprocity, and that is basically the way that your child interacts with other people in the world. So these are kids who may make very poor eye contact or very little eye contact, or can't sustain eye contact during a conversation or for more than a few seconds at a time. Your toddler may not respond to their name, but responds to other noises. So you call their name several times and they don't look or turn, but if a door slams, they'll startle or jump or look for it. They have a communication delay. This is different than just a speech delay. With a speech delay, children will develop other forms of communication in order to get their needs known. But with a communication delay, they may not do that. They may not point to things or try to otherwise communicate with you. They may just cry or grunt or throw fits until you figure out what it is that they need. They don't typically respond to other people's verbal or nonverbal cues. Nonverbal cues. So they may not recognize when someone is happy or sad or mad or anxious. They might echo words or parts of songs or parts of shows, but kind of nonsensically. So they can say the words that you're asking them to say, but they don't use them meaningfully. They may not seem interested in other children or playing around or with other children, and they may even lose language skills. So having been able to say something that they don't say now, that's always a big red flag for pediatricians. Your doctor would want to know about that right away as soon as you would notice it. The other category of symptoms or concerns in children with autism is restrictive and repetitive behaviors. So these are kids that are very insistent upon keeping their routines the same. They want everything done the same way every time. They may have very specific and involved rituals regarding mealtime or bedtime or when it's time to leave the house, and they may have a meltdown or a tantrum if their routines are not kept as is. They may play with unusual items around the house, so playing with like a DVD case or a kitchen towel, or they may play with toys but in an unusual manner, so spinning the wheels on a truck versus driving a truck on the floor. They may line up their toys or organize their toys in very specific fashions. Children with autism also sometimes have what we call stereotypic behaviors, which are spinning or rocking, head banging, or hand flapping. They may also hold objects very close to their face or look at them from unusual angles, and they may be very sensitive to lights or sounds, or even have decreased sensitivity to lights or loud sounds, or have what seems like very high pain tolerance. There's no cure for autism, but with early diagnosis, we can intervene right away with appropriate therapies such as speech or occupational therapy, and behavioral therapy as well, to help your child with autism reach their maximum potential. It's important for every parent to be aware of the signs of autism because early intervention is key. You can find more information about autism on the CDC website. You can look for Learn the Signs, Act Early. You can search for autism on the AAP's website, healthychildren.org, or you can go directly to Autism Speaks, which is a wide range of vast information for anyone who has suspicions or concerns of autism. At Peacock Pediatrics, we have some specialized training through the Echo Autism program at the Thompson Center in Columbia, and we can help initiate and work a plan to have your child evaluated for autism if there are concerns. So please give us a call if you have any worries or further questions about your child's specific condition or situation. We'd be glad to talk with you further. Call us at 816-396-6026 and we'll get you an appointment, get you in to talk further. Thanks. Bye.